Now, although we've been focusing on the large increase in the number of coronavirus patients being admitted to hospital, paramedics around the country are also having to deal with call-outs for patients suffering from other life-threatening conditions, such as heart attacks and strokes. Already dealing with a huge workload and difficult conditions, they have also reported an increase in verbal and physical abuse against paramedics. Well, Martin Berry is a paramedic from the College of Paramedics. Thanks very much for joining us, Martin. Now, you really are the front line, often making the first contact with virus patients. How are paramedics bearing up?
It's tough, and we're dealing with a workforce that already have been put under a huge amount of strain and pressure over recent years, and are now having to step up and respond to this challenge. The spirit is still overwhelmingly positive. We're dealing with healthcare professionals that have joined this profession for a passion to do what they can to help those in need and to do their best by their patients. However, we must acknowledge the real long-term impact this is having on the workforce and on these healthcare professionals that are putting themselves at great risk to protect the public.
Yeah, absolutely. And quite often, as I was saying there, you're being called out for heart attacks or strokes. CPR is key in those instances. How are you dealing with CPR with the conditions that are prevailing at the moment?
It is challenging, and I would have to obviously highlight the excellent training and professionalism of paramedics and their colleagues. However, they are having to work through some very difficult circumstances, and we need to obviously make sure that we do everything we can to protect that patient and try and have a positive outcome. But at the same time, we're dealing with an epidemic like we have not seen in a generation. So we have to make some very challenging decisions. But ultimately, we need to make sure that the paramedic and the ambulance service doesn't become the carrier, that we don't simply become a very expensive route of cross-infection, spreading it across the UK. And that is why it's important that good quality provisions of personal protective equipment is delivered effectively and quickly, not just to the hospitals, but to the ambulance services, so we can manage this better in the community and prevent the cross-infection.
So just talk me through it. If you have to do CPR, you have to put on your protective equipment first, I assume. So it's all taking a lot longer. That must make people very anxious and nervous. What's the situation in that case?
So at the moment, the guidance is very clear that we are aiming to what we call a level 3 of personal protective equipment, which is what we're trying to do. So that is the apron, the mask, the gloves, and the breathing equipment. But what we need to make sure is that the call taker is getting information very, very quickly. So if someone calls an ambulance and they identify that someone is in a cardiac arrest, that actually the responder can be preparing while they are en route. So when they do arrive, they are kitted, they are ready to go, and they can respond to that patient and deliver the quality of care that the public would rightly expect from these highly trained healthcare professionals.
And I've been reading that some of your paramedics have been subject to abuse, and some have been spat out. I read this morning. Is this true? And have you heard these reports?
It is unfortunately true, and it's awful that we are having this conversation on Sky News and having to report that this sort of violence, both verbally and physically, to emergency service workers is continuing. Yes, the public are afraid and they are very cautious about what's going on, and we want to reassure them that we are doing everything we can to protect them. However, this sort of anger, this sort of response is totally unacceptable. These people that are responding to the general public are putting their own lives at risk to try and care for those. So the message that I would put out to the public is please work with us. Please be respectful that we're dealing with unprecedented amounts of demand, and the advice and the support and the care that may be provided to you is appropriate for you, and we're trying to deal with a large number of patients. So please be mindful and work with us rather than against us.
So just to be clear, you have had paramedics working in this environment of coronavirus, and they've been spat at as they do their work.
Yes, not just spat at, we've had other forms of threatening abuse as well. And it's truly awful that these individuals are having to deal with these situations. However, what I would say, the vast majority of the public are overwhelmingly supportive, and we are talking about the very few that put us all to shame, to be honest. And we are incredibly grateful of the very public shows of support, and it really does keep us and my colleagues and the entire healthcare professions moving forward and returning to work every day. So please, what we would say is focus on the positives rather than just the shameful few that are treating emergency service personnel in this way.
Yeah, absolutely. And Martin, are you getting the equipment, the protective equipment that you need?
It is starting to come through. However, as the number of calls, as the number of cases increase, we need that flow of equipment to increase exponentially as well. It is being promised. We are getting really positive communications out of providers, out of sources. However, we need to make sure they now follow through and they need to deliver that equipment, because that is what we need. And quite understandably, a lot of healthcare professionals are very cautious that they are being expected to go into work without the right amount of PPE. So we need to make sure that these channels of equipment remain open and we have this equipment available when we need it.
And just finally, and very briefly, Martin, I mean, what the level of sickness among paramedics, what sort of percentage are you losing due to the virus?
So at the moment, we're seeing a steady increase, and some of the reports across healthcare more generally is around sort of 1 in 4 people are either currently self-isolating or are in the process of returning to work following a period of self-isolation. But it is important we're not just seeing people self-isolating as a result of the coronavirus. We're also seeing, again, this, something you're already aware of, the psychological impact on dealing with these sorts of situations. So what we are concerned about is individuals that are going to suffer long-term as a result of this pandemic. So we just need to be very mindful that not only do we provide the support to protect our staff and crews from the coronavirus, but also we make sure that we look after them. And if there was ever a time that we should care for our carers, it is now, because these people need to be fit both just physically and psychologically.
All right, Martin, we appreciate your work. Thank you very much indeed for joining us. Thank you.
Thank you.